this video about genetic disorders, and so we consider, so in total we have quite pronounced genetic disorders. It is common and very strong disorders. So there was some in past such kids didn't survive. Now they have chance to live, and but not only these strong disorders can appear, but a lot of mutations happen in genes which are related to brain development and also to development of the immune system. And such children in past, like 100 years ago, they at least half of the mortality rate in childhood was very high. More than half of the kids dying before age 3 years old. But now it is because of advance in medical care, and the mortality is very low. It is less than 1%, and it only in case of very, very severe some genetic disorders, children do not survive. And then what is a problem actually, that children with some minor genetic disorders, the minor mutations, number of these children, number of these people accumulate, and they have own children, and then these mutations, number of people with such mutations is increasing, and then, but and we have problem with health of such people, and problem with level of intellectual abilities. So okay, let's consider these common genetic disorders which are strong, which are easy to see, and easy to detect. So first is the Down syndrome. You know that this is additional chromosome, number 21st chromosome in the cell. So this disorder somehow very common, and it happens in children from parents who are older than 35 and age of 40. So if women try to get a child in age of above 40, the probability to get a child with Down syndrome is increasing. Down syndrome, and then it's such children cannot have own children. They're infertile, and they can be useful members of the society, not big problem. Again, it depends on care, depends on education, and so these people, they can develop good abilities and in intellectual abilities, so it's not big problem actually. And but yet it is genetic disorder. Another genetic disorder it is Fragile X syndrome. Fragile X syndrome, it is again special phenotype can be visible. It's elongated face and a broad forehead, and actually such people can be physically very strong, and then can be some successful athletes, but yet the health can be not good enough, because they have problems with scoliosis and with bones. So bones are developed not so well. Okay, but whatever, this is a syndrome, so people can survive and can live relatively long. Here we can see typical photos of children with such syndrome. And as I said, quite many look normal, and they can be again useful members of society. It is not so big problem, but health, of course, not so strong. What is deadly disorder? It is cystic fibrosis, and this was very dangerous disease, very dangerous disorder. genetic disorder because so what was happening, you probably know that cystic fibrosis and fibrosis in organs like liver and kidney and lungs, it develops in old age, almost in all people, because extracellular matrix is getting stiff, and then a reaction of the fibroblast, special cells that produce collagen, to this increased stiffness, that they are activated and they produce even more collagen, so the extracellular matrix gets even more stiff, and lungs are losing elasticity, so people cannot breathe with lungs because they are not elastic. You cannot inhale air with such lungs. So mostly people die from this fibrosis in lungs, but also kidney and liver are damaged. This is that way people don't live too long. And people normally, the child with this genetic disorder, the genetic disorder like it was for elderly people, but it was developing very quick and in young age, and somehow that's again it is a pronounced phenomenon for elderly people, but somehow kids were getting old very quick. This is just again, they were getting, the aging was very quick, and they normally didn't survive into adulthood, and they were dying in childhood. But now, okay, with some treatment, they can live a little bit longer. And this is next is thalassemia. Thalassemia, it is a deformation of red blood cells. Okay, this shape, a little bit strange shape of the red blood cells, is not deadly. Kids can survive, can live, but of course, immune system works not so well as with normal blood cells. And what is again very hard genetic disorder, it is so-called Huntington disease. Huntington disease, it's again somehow related to Alzheimer's disease. You probably know that Alzheimer's disease results in that the muscles, the brain cells are dying. They are dying, and because of malnutrition, because mostly old people develop this Alzheimer because they are getting diabetes first type 2, and then it develops to type 3. In type 3 diabetes, it is just like insulin resistance develops in brain, and brain cells starving. They just dying because they cannot consume glucose from blood, even if concentration of glucose in blood very high. The sensors doesn't work, of the cells doesn't work. They cannot consume. They cannot. The glucose cannot get inside the cells, and brain cells, neurons are just dying out. And the same somehow in kids. It also develops in young age, mostly in about age 15 years old, and they don't survive long. It is again this kind of morbidity for elderly people, so it is problem for older people, Alzheimer, but it develops very quick in young children, so and children will die. But again, the change of the diet can help them to live a little bit longer, because if they change diet to ketogenic diet, if they use fatty acids as source of energy instead of glucose, then this syndrome probably will not develop so quick, so they can live a little bit longer, I don't know, to adulthood. But mostly again, it's this is just accelerated aging, and to cure it, it's So official medicine considers that there is no cure, but non-official opinion, or my opinion, that no, this is equivalent to Alzheimer disease, and of course you cannot cure it, but you can alleviate, you can reduce the symptoms, and if you change the diet. Okay, this is also some photos of the brain, and it is absolutely very common for elderly people that Alzheimer disease, for Alzheimer disease, brain is shrinking, brain is losing neurons, and this the same phenomenon develops in some people. So it is genetical disorder, but this genetical disorder is can be not cured, but can be reduced somehow. And but genetically, it is DNA copies. They have some gene which is hyperinflated, induced. They are turned on. Some genes are turned on, and that's what we have. That brain cells are dying, and as I said, another type of disease, very, very severe, that children cannot survive, and life expectancy only 2, maximum 5 years. And this develops in this disease, Tau-Sachs disease. It's again related to brain damage. Brain does not develop, and children do not survive. Somehow you see that many diseases are related to brain development, and aging also is related to brain development. This is so-called cleft lip and palate. It's considered as genetic disorder, but actually it can be treated. By surgery, of course, after the birth. But it happens also if mothers do not get enough vitamin D during the pregnancy. So if mothers have enough, maybe some people have more vitamin D. Vitamin D is actually a hormone, and it regulates growth of bones in childhood especially. And if doses of this vitamin C for pregnant women should be above 10,000 universal units, international units. Okay, then Turner syndrome. This is it's one of the X chromosome is missing or partly missing, so it's results that women or females are not fertile, and also the features of the female, it's more like of a male. So one of the X chromosome is missing somehow. This is a sex chromosome, so it is female, but with missing X chromosome. It's interesting. But okay, these people may live, may survive, but they for sure not fertile. And what is also very dangerous disease, and it is muscular dystrophy, and it is normally develops. If it develops, then children in past they didn't live long, maybe to the age of 10 and no longer. But now, with better medical care, with some additional help and additional care, they can survive even to age of 40, 50. And again, muscles are not strong, but yet brain is working normally. It is so. It's what problem with these children? They cannot talk. They cannot because muscles also, all muscles are dystrophy goes in all muscles, including muscles which control the voice. So they cannot talk. And the most common, probably the most common disease is red cell anemia. Anemia, it is genetic disease. These people survive. Very many people suffer from this disease, mostly in Africa and Asia. It is somehow related to mosquitoes and to malaria. So people in area where there was malaria, in such disease like malaria, many people suffer from this disease, or they were just surviving because of this disease. They were surviving better from if they infected by malaria, but then it is just genetic disorder. Okay, that's all. So remember that genetic disorders, genetic mutations happen, and of course you have to be aware of genetic mutations. My opinion is that girls have to produce a baby not in very old age. So now it is very common that they are getting baby in age of above 30. But meanwhile, the best fertility and the best condition to have a baby in age of 20, beginning of 20s, even weight of teens, so age of 19 to 23. This is the best age, and somehow again this education, and women want to have better education. It takes time, and they are not getting married, and then they can have these disorders, and because probability of mutations is increasing with age, so it's quite difficult situation. So again, what to do? I would recommend for women to marry in younger age and to postpone a little bit higher education, and because higher education can be done any age, any time, especially with internet. It should be not a problem. Okay, that's all. The video is not so long. It's easy to watch it. Okay, take time and take care.